Today I want to be talking about what might be causing your elbow pain right here. I'm Dr. Danny Lehnert, a physical therapist at Eclipse Wellness in Sterling, Virginia, and I want to talk about something sometimes called lateral epicondylitis, sometimes lateral epicondylalgia, sometimes tennis elbow. And what that is that's pain right here, typically in your elbow. The reason it's called tennis elbow is it's associated a lot of time with tennis players. So what often happens is when you're playing tennis and you backhand, as you start to get tired, maybe you go from a two-hand to a one-hand backhand, and you have an overuse injury of doing this a bunch of times, and that stresses the muscles in this area and the tendons here. The reason it's called lateral epicondylitis is this is your lateral epicondyle, the bone right here on your elbow, where a lot of these muscles run into. And so what can happen is there can be inflammation and irritation in that area. So epicondylitis, itis means inflammation, irritation. The reason that we've kind of moved towards lateral epicondylalgia refers to just pain in the area. Sometimes there can be breakdown of tissue, but it's not always related to the inflammation, and the inflammation doesn't always cause pain. So lateral epicondylalgia is the technical term for it, but tennis elbow is what more people know it as. Now, as a physical therapist, it's important to look at a lot of reasons for tennis elbow and what we can do about it. A lot of the times it can be due to poor form, poor mechanics. Like I said, if you're playing tennis for hours and hours and you get tired and you're just doing this over and over again, maybe you played a little bit of tennis, maybe your form's not good, maybe you have limitations elsewhere. So I want to talk about what tennis elbow actually is, what I like to do about it, and how people can prevent it in the future from happening. When we're understanding tennis elbow, it's important to understand the anatomy of the surrounding area and what causes the pain. So this is a simple drawing of your elbow. This is your upper arm. This is your lateral epicondyle, kind of the tip on your elbow right there. And there are four main muscles that run down into your hand that are mostly responsible for extending your wrist like that. So think about the backhand motion that we were talking about. So when you have pain because of tight muscles or irritated muscles, a lot of the time that pain occurs at the tendon, which is where the muscle runs into the bone here, in that lateral epicondyle. So that's where you typically get the swelling, inflammation, irritation. So a lot of treatment, things like that, will involve manual therapy and everything in the middle of the muscle here, trying to relieve that tight area, those tendons that are pulling, tugging on the bone that are getting irritated. Now, typically with tennis elbow, it's going to be on one side versus the other. We always want to rule out neck issues, things like that, that could be causing nerve complaints all the way down the arm. Typically, if it's on one side, we're not as worried about that, but it is good to rule out the neck, and we'll talk about that in another video. But what we want to do is make sure that this is the area that's causing the pain. Now, a good way to make sure that's the area that's causing the pain is to do a couple tests. One test that's super easy to do is called the middle finger test, which is literally just pushing your middle finger up into your other finger here. If that's painful, super painful, especially in that area that's hurting, that's a pretty good sign that that's what's going on, because you're isolating those muscles that are meant to extend your wrist. The other things that are typically painful can be gripping, squeezing, twisting activities, because some of the muscles that do supinate and pronate your arm are located in that area as well. So things like opening a door, opening a jar can be quite painful. The other thing is just pure gripping can be painful. So it's important to understand, if I'm trying to grab something, I'm instinctively going to extend my wrist to let that happen. If you try to grab something down here, it's not nearly as strong as if you're pulling back like this, engaging these muscles here. So a lot of folks will come with just pain with gripping in that area, and we have to explain, oh, that's because you're extending your wrist when you grip, and that happens. So now I want to take you through a few exercises, tests, stuff like that I like to do to treat tennis elbow and eventually prevent it. So next I want to talk about how I, as a physical therapist, treat tennis elbow. So like I mentioned in the beginning, it's important to rule out that it's not a neck issue or even a shoulder issue that's manifesting in the elbow. So sometimes you can have nerves that get irritated running down the neck that can get irritated in that elbow area. So it's important, as part of my assessment, we'll look at cervical mobility, make sure we're not missing anything, look at shoulder mobility, because if those are very limited, that might be an area that we attack initially, in addition to some of these exercises of some stretching, some mobility for the shoulder or the neck. A great first step when we're talking about tennis elbow would be manual therapy. Sometimes that's massage, scraping, things like that. Sometimes that's super irritable. I find that dry needling is very effective for those muscles in the forearm, because I don't have to do as much compression with manual therapy and massage. It can be a little more targeted with the dry needling, help things release, and then go from there. I also like using things like a Mark Pro or something like that to get some muscular contraction to fatigue the muscle and also get some swelling decrease and everything in that area. But talking about specific exercises, as I mentioned, the biggest thing that these muscles do is extend your wrist. So that's the thing you're going to start with. So Isometrics refer to when you're doing an exercise and the muscle is not moving. So it's a great place to start, especially if you're super flared up and that you can do throughout the day. Would just be taking your wrist here and gently pushing it into the other hand for about 10 seconds. So I would recommend doing that in a relaxed position so that your shoulder and stuff like that isn't working super hard. But literally just doing that 5, 10 times for 10 seconds throughout the day. Now, if someone's super flared up, I'm just going to have them do that gently just to get those muscles firing, to get the blood flowing, to get them to calm down and stimulate them a little bit. But if something is a little less irritated, we might push a little bit harder into a little bit of discomfort, because you do need to poke the bear a little bit with issues like this, especially if it's a chronic issue that you've had for months. We need to go a little heavier to provoke a little bit of discomfort to really stimulate that muscle and get everything firing. So if you do a bunch of those throughout the day, every hour or two, you're going to start building up some fitness in the muscle, get the blood flowing a little bit like that. But the benefit of the isometric is you're not overly stressing it. So you're not causing too much breakdown, because there's already a lot of breakdown in the muscle and the tendon. We're just getting things firing. And that can be what we do for a while, just to get everything to down regulate and chill out. Now, if the isometrics become easier, if we need to progress, things like that, really simple, we'll just grab a weight. You can use a light weight, obviously slowly progress your way up, and we're literally just doing wrist extensions. So I'll typically have someone supporting their wrist on a table or something like that so they can relax everything else, and we're just extending through here, working on a little bit of grip strength, because like we talked about, the grip is also playing a role in those muscles, and we're just extending through here, through this movement of we're going slowly, we're increasing the weight, we're doing things like that, and slowly progressing it as we're tolerated. Now, another thing that people often miss out when it comes to any sort of elbow issue is the elbow is mostly a hinge joint. It flexes and it extends, but also helps supinate and pronate your forearm. And a lot of those muscles can get bundled up in there, can get very tight when you're dealing with any sort of tennis elbow. So I love working on supination and pronation, grabbing some sort of stick or something like that with a little bit of weight to it, and just holding it out in front of you. Normally someone would be standing to do this, and just rotating back and forth. So when we start, it can just be a stretch. The stronger you get, the easier it is. You go a little bit lower down. All of a sudden now we're getting into strengthening, and we're just progressing from there. Now you can use a dumbbell. Sometimes it's a little hard to grip those. So I like just using some sort of stick or something like that that's got a little bit of weight to it to give you a little bit of resistance. Now that's a simple way to start loading the area. After you're able to handle stuff like that, and sometimes in conjunction, then you can get into more strength training exercises, triceps exercises, bench press, things like that, where you're gripping, where you're having to use those muscles at a higher intensity, but in more functional ways. So we want to focus initially, especially if you're flared up, on some light activation movement exercises for the area itself. But as quickly as possible, we want to get back into the functional things, because that's what's going to help you feel better and get back to overall training and well-being. So now I just want to talk about a few ways to kind of prevent tennis elbow if you don't have it and you're looking to prevent it from happening. So when it comes to preventing tennis elbow, there's a few things you want to consider. Obviously, I showed you some exercises. You could work on those on your own, even if you don't have pain. I'm trying to get your elbow and your forearm stronger. What I would really say is you need to look a little more holistically. So we often have physicals that we go to every year where a doctor checks your blood work, checks everything like that. And I really do believe in kind of movement physicals, in terms of checking in with a physical therapist, a trainer, someone like that, and seeing how you're moving and seeing what you can improve. Because a lot of the times, tennis elbow can be due to a force absorption issue. So tennis is the best example, the easiest way to talk about this. So if I'm trying to backhand a tennis ball and I'm super tired, or I'm just feeling lazy and I'm just kind of doing this, trying to create force, then all that force is just going into those muscles that are going into your lateral epicondyle that are getting irritated with tennis elbow. Now, if I'm a little more engaged, or I'm a little bit stronger and I'm able to actually use my shoulder to do it, now the force is going through here and through here, which is good, but it's maybe not ideal. So now all of a sudden, if we start moving through here, we're taking some more weight through our core. What if we're actually getting athletic like a tennis player, and we're moving our feet, and now we're using our hips? And now that force isn't just going through here, it's going through here, 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 here. It's going through all these places, and you're less likely to have a breakdown if the force is going everywhere and being absorbed. So really what you should be looking at is general fitness, and saying, it's not just an elbow problem, it's a shoulder problem, it's a neck problem, it's a back problem, it's whatever is limiting me from getting into those positions that are causing irritation in my elbow. Similarly, I'll see desk workers who are dealing with elbow issues, and a lot of times I'll assess them and their back is super tight, their shoulders are super tight, so when they're typing in a computer, they're typing like this because they're not able to move through their shoulder blades, they're not able to move their neck, things like that. And so if we can get a little more movement up here, then all of a sudden the stress dissipates from down in here. So it's really looking at it holistically and saying, what am I missing as an individual? When in doubt, general fitness is good. Because a lot of times what I see are these weekend warriors who are getting injured, where it's someone who Monday through Friday is working an office job, not really doing a whole lot. And then on the weekends it's like, hey, I play tennis for 4 hours one day and 2 hours another day. Or I've taken up pickleball, or I've done things like that, which are great. I'd rather you move than not move. But you're going to have to start training your body a little bit more like an athlete in order to handle those things. Our bodies don't like change, and doing 4 or 5 days of nothing and then all of a sudden going to do this a bunch of times, even if you have great form, is going to cause issues. That's not something we recommend doing. So maybe that's something where a couple times a week you're adding in some exercise to prepare your body for that, even if it's mobility, strengthening. It doesn't have to be, NFL style workouts 5 times a week. It can just be a little more fitness throughout the week to raise your overall capacity so the weekends don't hit you so hard. So those are some general suggestions that I have. Obviously, each individual is individual. I would recommend getting assessed by a physical therapist, someone like that who knows what they're looking at and can give you some guidance, especially if you're dealing with pain or even if you're looking to prevent pain. If you're in this area, Eclipse Wellness in Sterling, we'd love to have you in for an assessment. Otherwise, I'm happy to answer any questions you have in the comments. Thank you.